Hi guys, it's Mark at Lismore House Dental Practice here again. You may notice that today I am dressed in my normal clothes, and that is because today I am attending Lismore House as a patient, which I think is a good thing to do from time to time because it lets us remember what it's like to be on the receiving end of treatment rather than just being the caregiver. Now today I am not attending for dental treatment. Today I am attending Rebecca, who's also my wife, and today she's going to be doing some non-surgical facial aesthetics. She is going to be providing me with
anti-wrinkle
to
treatment.
my forehead, or as some of my friends call it, my five head. You can probably see that I've got some lines on my forehead, and also what would colloquially be termed my 11s, my frown lines. So the treatment today is going to be purely on my forehead, and it's going to be a twofold aim. So first of all, we're looking for some cosmetic improvement. We're going to be aiming to allow the muscles to relax and allow these folds that are building up to ease and relax and recede. Also the 11s is the same. Now I've got another hope, and that is that it will alleviate headaches. This has nothing to do with my eyesight. You know, I've had my eyes tested and my eyesight is good. But I do find that, you know, in a clinical day when I'm wearing my loupes, which some of you will recognise, so these magnify my vision, and we tend to use them when we do, you know, anything that requires precise details. So any operative dentistry, even in my examinations, I use a lower powered loupe. I find that a day spent in loupes, I often sort of frown into them. And by the end of the day, I can have a bit of an achy head, you know, just across here, and it's purely muscular. It's mild, but it is significant, and it's frequent. So my hope is that not only reduce the wrinkles that you can see, but that it will also provide sort of symptomatic relief for my frequent headaches. So I thought I'd do you a little before so you can see the before. I'll probably do a few photographs of the procedure itself, and in about 2 weeks' time I'm going to do an after, and I will let you make up your mind if it has improved my cosmetic appeal. I will tell you if my forehead headaches have improved as well. It's good to see a guy getting this procedure, because there's a kind of, although we live in the modern era where, you know, anything can go, there is still a kind of tendency for facial aesthetics to be the domain of female clients. And that's simply not true. You know, anyone can have this done. Male, female, whatever, you can have this done if you wish. I'm assured it will be pain-free. Rebecca is an absolute dab hand at giving local anaesthetic injections. I've experienced those myself, so I have no reason to doubt that her injections, which are a minuscule volume of fluid that gets injected with a super fine needle, I've got no doubt that they will be pain-free too. And I'm a bit of a wuss when it comes to injections, so I will give you an honest answer. Well, that's me had the injections. I've had 10 injections of
Anti-wrinkle treatment.
courtesy of Rebecca. I couldn't describe it as pain-free, but it was very, very mild, like a little scratch and slight pressure. So I will update you with the results over the next week or two. Hello guys, hope we're all well. It's Mark at Lismore House here again. I've just had my 2-week review with Rebecca for my
Anti-wrinkle treatment.
or as she corrected me, my Azulure treatment. She tends to use Azulure on men, but effectively they're the same thing. I'm pleased to say that my primary aim, which was to reduce my headaches after, you know, working intensely for periods of time, has been a great success. So since I had the treatment 2 weeks ago, I have not had any headaches, which has been great. I'm also pleased to note that I can still move my eyebrows, less than I did before, but I still can, which is good. The frown the 11s have certainly reduced. I can still frown a little bit, but not as much. So that's a good thing. So apparently I don't look as angry anymore, which is good, because I was unaware that at times I did look angry, even though I didn't feel angry. Just this habit of frowning just from working, you know, closely in patients and really focusing. I was just in this habit of really frowning. And when I do try and frown now, this is not forming, and this is where the headaches tended to emanate from. So from my point of view, it's been a great success. Rebecca's happy with the outcome as well. She did offer me a top-up if I wanted, which generally gets done at your 2-week review. If I wanted complete paralysis of the forehead, I don't, you know, each to their own. Some folk do want that appearance, some folk don't. So personally, I have not gone for the top-up, but if you did, it's all included in the cost of the treatment. So yep, I'm very, very pleased. I had minor discomfort at the time of getting it done, but if I weigh that up versus the quality of life improvement because of the lack of headaches, then it was entirely worth it. It's a bit like the saying, no pain, no gain. So yeah, very, very happy. I would thoroughly recommend it, and I will go and see Rebecca again in 3 months' time. So all the best, guys, and thank you.